Pandemic makes everyone panic, afraid, and cannot do anything outside the home. This is a dangerous virus where the virus is transmitted when we are in crowded because it is contagious if someone cough or sneezing and the spark is affected to a new person. He will be infected and directly attack the respiratory system, namely the lungs. Since COVID-19 came to Indonesia in mid-March 2020, the government immediately gave a warning to the community to stay at home, stay healthy, apply social distancing or physical distancing everywhere, and continue to exercise even if only at home. Those who normally work in the office now work from home, study at school now study at home, worship at a place of worship now worship at home. If I become president, I will improve these three sectors to cope with COVID-19. The first sector is health. If we talk about viruses, diseases, pandemics, and so on, they must be very closely related to the health sector. There are three types of health service, namely preventive, curative, and rehabilitative. Of course, to get maximum result in dealing with COVID, these three types of health service must be carried out simultaneously. In the case of preventive health care, the means to prevent people who have not been exposed are not exposed and remain healthy so that they can reduce the spread of COVID. In Indonesia, this preventive measure does not seem to have a significant impact on the spread of COVID. So what needs to be improved is to maximize the role of public health experts to educate the public in terms of prevention of COVID. Education to the community must be complemented interestingly so that people not only get knowledge but can also change their behavior in the health sector. The second, in terms of creative, what must be done is how to manage people who have been exposed to COVID. In Indonesia, what is still a problem in creative service is the convenience of the COVID test, both of the detection equipment and the lab or where COVID testing is done. This is a problem related to the large population and breadth of the territory of Indonesia. The faster it is detected, the faster it can be also be treated so that the percentage of recovery can increase. The second sector that is affected by COVID-19 is the education sector. In this sector, it is clear that all education institutions shift learning from face-to-face classes to distancing learning. Distance learning is based on the education environment, especially schools and colleges are a gathering place for many people. Therefore, all education institutions from elementary schools to higher education apply this system so that education continues to run as it should. But of course, the transition of the distance learning system still has obstacles that will be faced by both the education providers and students. The main obstacle is since that there is not adequate internet access in each region, causing some schools in interior areas not to use the distance learning system as it should. The number of complaints students will access the internet and expensive quotas is an important concern. In contrast to universities, in addition to problems such as school, in college institution for final level students, of course, it is difficult to conduct research and practice in the laboratory. What needs to be improved is to be given easy access to the internet to interior areas and provide convenience in the cost of buying quotas. These problems are still the duty of the government to continue to carry out the function of education amid a pandemic by paying attention to existing problems and finding solutions. Because the education sector is one of the most important sectors that must still be carried out in the time of this dangerous virus outbreak. Of course, not make a crowd and keep running health protocols. The third sector is the economy. All development have declined in Indonesia. This issue of the cabinet reshuffle continues to highlight issue of economic performance. There is a lot of pressure to overhaul the economic sector because the performance of the economy has made Indonesians suffer. Indonesia's economy continues to improve because it does not have strong economic fundamentals. When COVID spread, the government immediately limits public meetings, close national borders, and close all unnecessary business. All economic sectors have been closed in less than a week. The heartbreaking effects of a president, even such as employees who lost their jobs because their place of work cannot afford to pay all of their employees. What needs to be improved is to make it easier for people who are affected by the termination of work by providing regular daily necessities and evenly distributed.